Hello everyone, my name is Dr. Jacobs. I'm a doctor of physical therapy and I'm also the inventor of advanced soft tissue release ASTR specialty. I am a cancer survivor and I used to suffer from chronic migraines, headaches, pain and fatigue before I invented ASTR specialty. All right, Sharon, tell me what's going on with your neck.
Well, I just pulled it one night and
okay.
I felt a lot of burning in this clavicle area. And then after that, every time I would do things that would kind of use these muscles right here, it would just burn and hurt.
How much pain or burning you feel there from 0 to 10? 10 is emergency room.
Well, when it first happened, I would say probably an 8. Like
8 out of 10?
Really burnt.
And you feel it in the front and yeah.
But now I would say it's just like a 4. It just
4.
Aggravates me.
So is that constant pain or just with the motion? Constant 4. But when you move your arm, that your pain increase or the same?
No, it doesn't really increase. It's just
tight
and weak. I feel really weak with my arm now.
Your shoulder now?
Yeah, my arm and shoulder.
How long this been going on?
Since, well, probably about 4 months.
About 4 months?
Yeah.
Okay. Have you had any treatment for that?
No, I had some tests to determine what was wrong with it.
Okay.
I haven't had any treatment.
All right. So let me see your range of motion left and right and tell me if you feel pain with that. So turn your head. Okay. Yeah. You're very stiff here.
It's just tight. I don't
very
know if
stiff.
It's really pain. Yeah. It's just tight.
Since that happened, you just had that limited range of motion.
But this one is a little harder.
Yeah, I can see that.
Yeah.
Extend.
But I still do my exercises since I had my
you're very stiff. Yeah.
You know, I started trying to do my exercises again.
And the other side.
That one's hurt. That one's has
okay. So when you move your head, where did you feel the tightness, in the back or the front?
The front, right here.
Everything in the front.
Right here.
And how did you hurt it?
I just stood up and was handing the remote control to one of my friends. I was going to the store. I lifted out my arm. I think maybe I overextended it or something. I don't have a clue.
Yeah.
It was crazy.
All right, so everything should be pain-free, not aggravating your symptoms. So,
well, once I had my X-ray and I knew that I had nothing wrong with me in as far as blood clot.
So you had the images, and what did they say?
He just said that I have stenosis. I forget what numbers he said. And then he said that he was going to have me do physical therapy with you, and if it didn't get better, then we'd have to maybe look at surgery.
Oh, okay.
So
you have a spinal stenosis?
Yeah.
Okay.
Up in the neck part, I guess. Okay. I forget what numbers.
But your pain in the front was
just right here.
That's burning.
Yeah, but I always kind of have grinding. Remember, we kind of worked on that before with my hip.
Tightness.
And that kind of went away. Yeah, like sand when I rolled
so
my
the
neck.
grinding that you had in your hip, you still have the same here in your neck?
But
make sure this is not painful what I'm doing. Okay.
Yeah, it's better than it was when I first pulled it.
That was 4 months ago, yeah? Okay, let me know if that's painful, okay?
Okay.
How does it feel? So you feel the burning all over here, or just this?
Just right here, just across this, you know, you can put as much as you want.
Okay, make sure that's not aggravating. But too much, or it's okay?
That's okay.
Okay, so tell me, we're going to take another video for that, but we can have this conversation. Okay, so you remember when we worked on your toes? How many treatments we had for the toes?
We just had the one treatment.
One treatment.
Yeah.
And did you have any pain after that?
No, I've had no more pain on my toe.
So one treatment, and how long your toe pain was going on before that treatment?
Oh, gosh, it was, I don't really remember. I know I had broke my toe, and so it was healed, but it was months, about 7 months it hurt.
7 months
after,
one treatment?
Yeah.
When was that treatment? That was a while ago. How many months?
It was, I haven't been here since September for my hip, so maybe in April last year.
Actually.
Maybe, I don't know. It's been a while.
Was it August?
August? Yeah.
Yeah,
my toe's great.
So August, we are in end of February. So that's a good 6 months, yeah?
Yeah.
Wow, that's good actually.
Yeah.
7.
7 months? Oh, yeah.
And my hip is
You're
great.
better mad than me.
My hip is great too. It's
That's
like,
good. So 1 treatment for the toe and 7 months follow-up and no pain. That's great.
Yeah.
Yeah, that's good.
Yeah, whatever was catching on my toe is all gone.
Yeah, that's beautiful. I'm
Yeah.
glad you're doing better. Yeah. Is that too much here?
No, it's okay. Like when I first did it, pulled it, I tried to rub it like you do.
No. Nobody can do what I do.
And it kind of made me
No,
nauseous.
don't do that at home, okay?
Yeah, it kind of made me nauseous.
No,
like,
you don't want to try that. You have to use an instrument and you have to know what you're doing
Yeah, I was
because you
just
actually cause a
rubbing,
flare up.
Yeah.
For the slip, you decided to go for fats.
Is that too much what I'm doing?
Yeah.
No, the problem with this, I give actually 4 days full-time teaching class to
Uh-huh.
doctors. So it's a very intense training. So it's not, if people look at the video and try to do it at home or from the treatment, they're not gonna get the same results.
Right.
And you might cause a flare-up. You have to know what you're really doing. Otherwise, you know.
Yeah, I just tried to
It's not
massage
gonna
it,
be-
you know, when I
yeah.
first heard it, and it was like,
Is
it's
that
gonna
too much
be,
what I'm doing here?
no.
Okay. I don't know if it's too much, okay. So the burning, you said 4 or 5 when you came here today?
Yeah,
Okay.
it seems to burn a lot. That's kind of its problem,
Yeah.
is burning.
Okay. How about now? Can you tell me the difference? Let's move your neck left and right.
Oh yeah, it feels a lot less tight.
Do you still feel burning or it's gone?
I can still feel a little bit of burning.
0 to 10.
Probably around 2.
Where?
Just kind of right on this.
So it's in here,
Right here. Yeah.
just in here.
Yeah.
Just in here. Okay, let me work on the scar tissue here. Just relax.
Okay.
Relax. I usually do it lying down, but just for the camera, we'll do it sitting this way. Okay. But nothing in the back of your head.
No, my back of my neck is, like I said, the only thing that's affected there was the tightening of my muscles from me not exercising anymore.
Yeah. You feel
Yeah.
that scar tissue here?
Yeah.
That's grinding here.
Yeah.
Okay. You feel that.
So
But you don't remember any past injury for this area?
well, you know, when I fell down on my hip, you know, I kind of
You
twisted my whole body.
your whole body.
So who knows? I mean, because only my
Yeah.
hip was what was like my major pain.
Yeah.
Because I remember that I hurt my knee that time and my hip and everything, but my hip continued hurting.
How's your hip doing actually?
My hip is great.
Do you know how many treatment we had for your hip?
I don't know, a couple months, 3 months maybe.
No, the treatment for your hip. Yeah. You had like,
I think twice a week for
yeah, for a couple of months.
3 months maybe, 2-3 months.
Yeah, 2 months.
Yeah, my hip is so much better. I tell all my friends, I pass your cards out all the time. You know, because
Okay, so let's move it and left and right. Left and right, let's feel. You still feel numbness or gone?
it feels better.
0 to 10 the numbness.
Well, right now it just feels a little. It doesn't numb. It feels a little burning, tingly.
What is the burning?
It's kind of spread now, like, you know, just kind of like not on the bone, just kind of not really. I don't know how to explain it. It's like not really burning. It's kind of tingling, maybe, kind of.
Where do you feel it?
Just kind of like radiating around.
Around there?
Yeah.
Okay. Okay. Let me know if that's too much. Is it okay to work on this area here?
Yeah.
Okay.
Yeah. It's like just kind
Right
of.
here? You feel that scar tissue here
Yeah.
as well?
Now,
Yeah,
was
that's
that a
right.
tendon? Right. That was right here.
Well, you had the clavicle bone there, and you have the intercostal muscles around this area.
Is that what
Okay.
like pulled and burned when I
And this
overextended
is
my
your
arm?
pec muscles. Yeah, your pec muscle.
Okay.
Pectoralis around here. So, so what I feel, you have a scar tissue around those muscles, and your fascia is very tight. Is it too much? But you
It
feel
hurts
all
a
this
little bit,
knots?
yeah, I
Sorry,
do.
sorry.
That's okay. I do feel like, yeah, like it's real tight over there.
It's a lot of knots in here. Yeah.
Okay.
Sorry.
That's okay. Yeah, it's a little tender.
Yeah, you feel that? It's
Yeah.
a really long resource.
Yeah.
So, okay.
That's okay.
Okay.
I come back on Wednesday, I think.
Mm-hmm.
So.
Okay. Mm-hmm. Did you hit your head before, ever?
My head, well,
Ever?
yeah, probably.
Mm-hmm.
I'm a faller. I've fallen a number of times.
Okay, so do you remember any like bad hit in your head?
Well, yeah, one time I tripped and fell into an engine, an outboard engine in the trash can. They were working on it.
Oh my goodness. Where did you land it?
In the front of my head, I think.
Okay, so let's move your neck and tell me how this feels from 0 to 10. Look at that.
Oh, it feels way better.
Yeah, your range of motion.
Yeah, it is. It's way better.
Mm-hmm. Do you still feel that burning or it's gone?
No, it feels really better.
Mm-hmm. Okay, so let's take your glasses off. And you said you hit your head here?
Yeah.
Okay, so I'm gonna work on this area and I want you to let me know, releasing this area, if that changed the burning here and the range of motion
Okay.
here or not, okay?
Exercises.
You're gonna feel cold, okay?
Okay.
So, just give me more history about your head. Like, did you have any other trauma or any hit in your head?
No, I think when I fell down the stairs, I avoided my head. I fell on my arm on this side and twisted, so
Yeah.
yeah.
But this,
No,
did you
just
lose
a-
consciousness?
Do you know, I didn't, but
Mm-hmm.
I did go like right away and go to bed. I was kind of embarrassed. It was like a new house and I was coming in the back patio with my laundry and it caught on the gate fence and it kind of threw me into the engine. So
Wow.
I remember being like, oh my gosh, I can't believe I did that. And I was like, I'm okay.
Mm-hmm.
And then I just went to bed. So, yeah,
Mm-hmm. No, if it's too much, okay?
yeah, it's okay.
Okay. Okay, let's turn your head and tell me how that feels. How's that?
Well, it feels good.
Mm-hmm. Extend and flex. You still feel any burning or it's gone?
No, it feels really good.
Mm-hmm. Any symptoms?
No, it feels really good, huh?
Did you feel any difference when I worked on the head?
Yeah, I just feel really good. I mean,
Yeah.
I don't feel grinding of anything back in here, in my head and my neck.
All right.
Yeah.
Awesome. All right, so what do you think about ASTR treatment?
Well, I'm a firm believer of ASTR treatment, just with my hip, so I was very looking forward to
Yeah.
coming because I do not want neck surgery.
Yeah.
So if we can get me all healed, I'm
Mhm.
all for it.
Yeah, awesome.
Yeah.
I'm glad you're doing better.
Yeah, I
Thank
am.
you so much. Thank you.
Uh-huh.
Feel free to subscribe to my channel to get updates about helpful information and tips and tricks on how to relieve your pain and your patient pain. Also, there's over 170 videos, most of them actually real treatment videos. I'm showing how I use ASTR instrument on the patient, and you can actually see the result in the video within the real treatment videos. If you are a healthcare provider, feel free to register for ASTR class so to learn how to actually treat your patient effectively. In ASTR class, I actually utilize over a 400 research study. That's actually what I use as part of the treatment, and that's what I will go over with a health practitioner to learn how to practice effectively based on research study. See you soon.